that, let me begin by inviting up our first presenter. That's Ann E. Price, who is the Director of Closing the Racial Wealth Gap Initiative. She's with the Insight Center for Community and Economic Development. Welcome, Ann, and I think you have a presentation and a PowerPoint for us that should be set up because we had our IT folks here. If you want to, yeah, I'm sorry. Can you see okay? Oh, okay. Thank you, Dawn. Thank you very much. So thank you for being with us today, and the floor is yours.
Good afternoon, Madam Chair and other distinguished members of the Assembly Committee on Aging and Long-Term Care. I am Anna Price. I am a director at the Insight Center for Community Economic Development. We're located in Oakland. Insight Center is a national research, consulting, and legal organization. We're dedicated to building economic health and opportunity in vulnerable communities both in California and across the nation. I really appreciate the opportunity to speak to such an important and timely topic, and that is the financial stability of older women in California. Over the next couple of minutes, I'm going to briefly outline how Insight and its partners are transforming the way we address and measure economic needs of older Californians. I will then speak to what stands in the way of a life of economic stability and dignity for older women in our state. And finally, I will close my remarks by just noting ways in which California policymakers can improve the economic fortunes of women as they age. We know that older adults in California and across the nation are struggling to make ends meet. Their fixed incomes do not cover the ever-increasing costs, and our public policies are not also closing the gap. Even those seniors who've worked all their lives and now are drawing on their retirement accounts, their pensions, and Social Security are often unable to make ends meet. So at Insight, we are promoting a tool that measures the basic needs of a person ages 65 and older in California, and it's called the Elder Economic Security Index. We call it the Elder Index for short. And it was developed as part of a national Elder Economic Security Initiative, a program at the Wider Opportunities for Women. And we partner with the Center for Health Policy Research at UCLA, and they do a lot of our calculations. The one thing to know about this standard is one thing that it makes very, very clear, and that is that the federal poverty level vastly underestimates the actual income necessary for even a bare bones existence in the state. Yet we know it's used to determine income eligibility in a lot of different programs and to allocate state and federal resources in our communities. This measure actually promotes income, a measure that respects the autonomy goals of older adults, and it's a measure that certainly is better than thinking about poverty. We know in the long run we would like to see this outdated and flawed federal poverty line removed, but for now the Elder Index can immediately be used in conjunction with the federal policy measure to more accurately evaluate the economic security of California's elders. So just how are women faring using this index? Using this index, 1 in 2 women, older women in our state, living alone, are under the standard. That is, they're barely making ends meet. Even those that live with others, such as a spouse, 1 in 4 of them are not making ends meet. One thing we're beginning to do at the Insight Center and with UCLA is to explore how changing family dynamics impact economic security for older Californians. Oftentimes we think of older adults needing caretaking and don't think about them as caretakers and what that does to their own pocketbook. I'm going to point out 2 examples of some of the data that we've begun to look at. One is the cost that it takes to house a older adult who's moved back in with a parent. Now, oftentimes we joke about young people, older adults moving in with their parents. But actually for many, many Californians, it's actually no joke. I can actually say, ask my mother. She knows all about it. But it really does threaten our economic stability. Our report finds that 2.3 million adult Californians were living with their parents in 2011. That's a 63% increase over what we saw in 2006. So it's certainly having an impact on our community. One of the other configurations we've been looking at is grandparents raising grandchildren. And let me just go back to the slide for 1 second, and just so you can see the gap between how we measure poverty, which is around $14,000, to what it really costs to have an adult child move in with you, which is about $36,000. It adds about almost $13,000 to your budget. So you can see almost a $22,000 gap in what the poverty level is and what it really costs. And looking at grandparents raising grandchildren, we're seeing that this is what, as well, is really impacting older adults. It costs about $5,500 over our standard to raise one grandchild, that is for a renter, a single grandparent. And it's also about $11,000 higher than the poverty level. So we know that if the empowerment of women was one of the great changes of the last century, addressing its social and economic implications will be one of our greatest challenges in the next 50 years. So I want to quickly speak to 4 reasons why it's important that we think about the economic security of older women. The first is simply the demographic shift, which I'm sure that you've studied and know a lot about, but our elder population is growing and becoming increasingly diverse. Today, roughly 1 in 10 people are older than 65. In the next 26 years, by 2040, about 1 in 5 people will be 65 and older. Over 2.3 million women in California are now 65 and older. But in the next 26 years, that number will grow to 5.5 million. That is 2 million more people than the entire population of Vermont and Maine and New Hampshire put together. So 1 in 9 Californians will be a woman 65 and older. We're also going to experience growth in women of color. Today, women of color make up 40% of all women 65 and older, and by 2040, they're going to be 59% of all women seniors. We also know that women in California are living longer. Women outlive men by a margin of 5 years, 82.5 years versus 77. And we know that the fastest growing groups of older women are Asian Americans and Pacific Islanders and Latinas, who have the longest life expectancies. Many women in California are concentrated in low-wage jobs, and it's having a huge impact on what happens when they become older. They face a number of hurdles in turning work into wealth. One is the occupational segregation, jobs without health or retirement benefits, continued direct discrimination in the labor market, and the undervaluation of work that performed by these women. We know that these forces cluster women into low-wage jobs, and they've pushed women of color into the bottom rung of low-wage positions. Nationally, over 8 out of 10 workers in healthcare support and 7 out of 10 restaurant workers are women. And here in the state of California, 6 in 10 minimum wage workers are women. We know there's a lot of debate about raising the minimum wage, and we have a higher minimum wage than most states. But if we were to increase the minimum wage to $10.10 an hour, nearly 1.3 million women in the state would get a pay raise. So it is significant. I'm going to talk a little bit about the wage gap, and we know that that also fuels economic insecurity. And despite the progress we've seen among women, the wage gap has only really budged 1 cent every other year since 1960. So women make 1 cent more every other year. But the gap is pretty stark, particularly for Latinas. They earn 43.6 cents when you compare that to what white men earn. And I'm just showing you this little map. And I think what's significant is this is our fastest growing population. It will be one of our fastest growing aging populations, yet their wage gap is higher than all of the states that you see there, all of our neighboring states. And actually California has the second worst wage gap for Latinas in the nation. Only New Jersey has a rate that's lower than 43.6 cents. That means that for every dollar a man makes, she makes 43.6 cents. So we know that what's really important is that women have access to what we call wealth escalators, and that is that they have access to fringe benefits such as paid sick days, health insurance, or retirement plans. These things put money in the pockets of women, and they provide them with direct wealth, and that is employer contributions to retirement accounts. But we also know, given what I just talked about in terms of the types of jobs that women are concentrated in, that they are closed off to many of these wealth escalators. So what can we do to improve the economic security of women? I just want to make two final points to this committee to support policy and budget work that you undertake in this year. First, California's economic recovery is underway, but ensuring that struggling Californians make up ground that was lost during the recession will actually fuel this recovery. I think we can make a very strong economic case for supporting our elders by putting more dollars into their hands and thus into our local economies. That money goes into their hands and out the door for food, for medicine, and a host of other things that they need. Ensuring that lower income Californians make up this ground during the recession, as well as the erosion of our middle class over the several past decades, will actually fuel this recovery. So we have made some important strides. One is that we have been using a measure that more accurately reflects the cost of meeting basic needs. It has been our intention that this measure help bolster existing senior services in California and make government supports more efficient by letting you know, and those that are working to help seniors, which programs are the most effective in helping them reach economic security. The Insight Center led a coalition in California that fought successfully to win enactment of the Elder Economic Planning Act of 2011. We are so pleased that the California legislators, led by some of you here on this committee, recognize this tremendous need by passing this law. It's the first of its kind in our nation, and it requires that area agencies on aging use the index to inform decision-making and planning for the needs of our state's older population. This summer, we're going to be evaluating the efficacy of that law to determine how it's actually helping seniors and how it's helping us make better decisions. But we also need to put more cash in the hands of older women and restore critical services that help them get by. We know that the maximum cash benefit through the supplemental security income, which is known as SSI, plus the state supplement of $870 a month, puts people well below the poverty level and $13,000 less than what our index indicates people need to get by. So cuts made during our recession really increased poverty in California and slowed our recovery by really taking dollars out of the hands of seniors and out of our local economies. In addition to the great human hardship caused by these cuts, it's critical that we remember their damage to California's economy and our communities. Madam Chair and committee members, thank you for your time today and your service to the 2.3 million older Californian women who are counting on you to help them live with security and dignity. Thank you.
Thank you very much, Ms. Price. Thank you. We can go like this when we're clapping. Any questions or comments from my committee members?
I just have a clarification.
Yes, Mr. Levine.
Yeah, I just want to make sure I understand this right. So you're talking about for a comparable job, or just brought in with that slide in particular, a comparable job, or just generally?
Just generally.
Okay.
It's a measure that's commonly used just to look at wage gaps generally.
Thank you.
Thanks.
I'm glad to hear. Any other questions? Mr. Wagner.
All right, so that's now NH is for New Hampshire?
No, it's non-Hispanic white male.
Non-Hispanic white. Okay,
Yeah.
thank you. If you said that, I missed it.
Sorry, it's our wonky shorthand.
So as I understand it, you basically take all the non-Hispanic white guys and add up whatever they get, divide it by the number of non-Hispanic white guys, and you get a dollar figure, and then you do the same with Latina employees, and that's where the 43.6 comes from?
That's right. And there's many ways you can cut that. You can cut it by looking at women, different groups of women. You can look at Latino women versus Latino males. This is a standard way in which people look at gaps more generally to get a sense of its breadth.
Do you, in doing that analysis, correct for or account for age or education or immigration status or anything else?
Yes, there are a lot of, I just showed this as a basic kind of overview, but we can get down to looking at comparable occupations. We can look at how are people with bachelor's degrees faring. There's a lot of ways we can cut this.
This doesn't do it.
This is just the broadest of broadest measures. But what we've seen, and we look at national data and some state data, is no matter how you cut it, there's a gap. Of course, it can be much smaller than what we're seeing here, but even for people with degrees, what we're seeing is that women make as much with a bachelor's degree as a man will make with an associate's degree, for example. So we're still seeing, we're closing the gap, but we're still seeing gaps in wages for women and men.
Okay. And that 1.3 million figure you use for an increase in the minimum wage, any idea how many people would lose jobs as a result of that minimum wage increase, or how many people, co-workers, might not get raises that they otherwise were in line to get because the money's been redirected to a minimum wage worker?
No, this particular analysis doesn't look at job loss. What I think that some of the focus of some of the analysis that we're looking at, seeing in terms of minimum wages, is really thinking about how that money can really fuel local communities, because we know low-wage workers actually spend a lot of money. That's money that goes right back into the economy and helps build other jobs. So when you think about just a direct job loss because someone's paying someone $3 or more an hour, what is the kind of trickle effect if that person puts that money back in the economy and supports small businesses by buying clothes or other goods? So we know that this is an ongoing debate with a lot of opinions about that. I was making the point basically that here in California, if we don't think about low-wage work, particularly for women, and given this demographic trend, we're going to see a lot more women really struggling to get by, and that was basically the point of thinking about low-wage workers.
What analysis tells you that $10.10, which is the number you used, is the right number instead of $12 or 15 or?
There are a lot of proposals out there.
In fact, $12.
Some of them
analysis that says that's the right number.
There are actually some proposals by business leaders here in California that propose a higher level of $12 that's being promoted. There are a number of different minimum wage kind of proposals. This is kind of the one that has been bandied about in national conversations.
Yeah, now, I know there are lots of proposals. Mm-hmm. I'm asking, what's the analysis that says this is the right number as opposed to some other? I mean, have you got that for us?
I think some of it's around political temperature. I think some of it, people have said we need a minimum wage as high as $15. You can see from the index what it would take to really, and this is really measuring, these are actual costs. This isn't an estimate. This is what it costs to rent. This is what it costs to buy food. This is what it costs to live. So what would it really take for people to reach a level of basic economic security? We know that hovers somewhere around $17 to $20 an hour. So it's much higher than what we're even seeing in these proposals. So I think that the discussion is really talking about what will it do for our economies if we can get people into better wage jobs. There's also a flip side to that you've raised, is what would it mean for people not to rely on certain services? So I think our analysis has to be really thorough to think through all the implications of a wage increase.
I'd agree with that.
Yeah. Mm-hmm. Thank you for your comments.
Just one quick question from me then, if I may, just to kind of wrap up. In terms of the policy implications of the many women who are currently in low-wage work and who have, through their lifetimes, and, as this is the Committee on Aging and Long-Term Care, mm-hmm. we look at the projections, the whole issue of the cumulative effects of low-wage work at the other end of life. We talk a lot in the Assembly about our budget priorities. We talked today, in fact, about child care as a priority for restoration in the budget. But I'm concerned about the balancing of the discussion about elder care and about issues that older women are facing. What do you think it would take for our state to have a more direct conversation about, and we all love children. I have two myself that have somehow managed to grow to adulthood. But I often hear our priorities centered around the needs of children, which, many of us in this room also embrace. But what do you think it's going to take for us to shift a little bit and raise the profile of the needs of older women who have many times through their entire lives served as caregivers for children as well as elderly relatives or spouses? Do you have any advice for us?
Well, I think that I think two things. One is that we really need to hear more from the stories of women in our state and what they're facing. When we released this study about older adults moving in with their parents, we were actually looking for some folks to speak to that issue to reporters. And I realized my mother can speak to that. I'm facing that right now in my own family. And seeing that this isn't just an economic issue. Sure, my mother's has had to make some sacrifices because she loves her son. But this also has to do with how people think about their own children, how they live with dignity. And I think that there's some very powerful stories and ways that we can really understand how this is being played out on the ground. So we need to hear more from seniors in our communities and people that are working and supporting seniors. I think, too, that what I was trying to get across in this very short presentation is the fact that when we think about what it really costs to live, we have much more really great analyses and information to help us understand what is happening, the extent to what's happening, the magnitude of the problem, where it's happening. You could go on our website. You can look at any county in the state and understand what's happening with these issues and know what it costs to live in Kern County versus Alameda County. So we have a good sense of what that is. So we have now tools that can help us make better decisions. And I think that's really, really important in this time. I would just also say that, we know it works for seniors. We can look and see how Social Security and Medicare, particularly how Social Security has lifted millions of people out of poverty. We know how effective programs can be. We can actually measure that. And we can measure its effectiveness. So I think that we have many tools that we can draw on and that policymakers can use to really be able to lift seniors up out of poverty. Thank you, Chair.
Thank you very, very much.